Welcome to Thriving Thursdays. How's everyone? Hope everyone's doing great. Yeah. Okay. I think we're all set. So joining me today is a lovely group of people. I love these people right here. Awesome group. I have Erin Brown, we have Dr. Kitty, and we have Jerome Smith. Welcome. I'm just gonna say, let you guys introduce yourselves. I guess maybe I should start with me, right? I'm Dr. Tracey King, clinical psychologist and owner of Thriving Haven. I am a co-host today with Erin Brown and all of these other lovely people here today. Go ahead, Erin. Lay it on us.
Hi, everyone. I am Erin Brown, Disability Inclusion Consultant of Erin Brown Connects, Disability Advocacy and Inclusion Management. And tonight we have a wonderful talk designed just for you.
I'm going to go next. Good evening, everyone. I am Dr. Kitiboni, Adderley, physiotherapist and owner of Handling Your Health, Wellness and Rehab. I'm so glad to be a part of this team. We hope that we will give you good nuggets, a holistic approach to whatever topics we deal with, and we're here to make sure that we meet your needs when it comes to overall health, mental, physical, emotional, spiritual. We're here for you.
Jerome, your mic.
We see the mouth moving, but we don't hear anything yet.
You do.
All right, can you hear me?
Yes, sir. Bring it home.
All right, awesome. My name is Jerome Smith. I'm actually the founder, creator of Sideline Sports and Entertainment Bahamas. And yeah, just glad to be a part of this group tonight. And I'm looking forward to our discussion.
Well, okay, so we're going to get started. All right, so
I'm just gonna, yes, it's on you now. Go ahead.
You know, when they tell you you're going to be the one to lead tonight, you're just excited and want to jump in. She is me. So just in case you haven't heard it already, Happy New Year. 2021 is officially here. We've made it. We're here and we're not square. That's my lame, corny joke for tonight. All right, so I want you to remember, though, to make sure write 2021 during your days, because I know I'm not the only one still writing 2020 when I'm writing in my date. So don't leave me hanging. I know you're still doing it. So let's remember to write 2021 when we do our date this year, because we're in 2021. So once again, I'm Erin Brown, your disability inclusion consultant. I'm a short, blonde-haired Black female with glasses and braces, and I identify as a limb difference individual. So during our last premiere, or during our premiere episode, we encouraged ways to increase better health in 2021 and its importance. And one of our takeaways was the importance of you. YOU, your intentional involvement in taking action to sustain better mental health moments in 2021 is reliant on you. So this episode, we are asking, how's your vision? Man, I almost felt like Wendy just now. How's your vision? Okay, we know that the word vision has dual meanings depending on its use. And when we're speaking about mental health, we ask, what is your vision plan for 2021? So the meaning of vision in this stance would be the ability to think and or plan the future. So I'm going to ask you again, Have you taken the time to set your intentions this year? I'm talking about take a moment to evaluate where you are presently in your mental health. Have you done that as yet? Well, no worries if you haven't. We're here to encourage you and to give you the space to do just that. So, Dr. Tracey, can you share with us why it is important to set intentions when it comes to mental health?
It's important. You know, we go through life bombarded with so many things. We find ourselves still in the midst of a pandemic. And because life has so many demands on us, we sometimes don't take care of ourselves. And in our last segment, we talked about better health in 2021. And that better health means being focused, making sure that you include your health, physical and mental, in your vision for your year. So when we talk about New Year's resolutions, we want to talk about being more productive, more successful, you know, always a better health, sometimes losing weight because this is the new year and we always feel bad after, you know, the holidays of eating so much. But it's important to recognize that when you start your vision for 2021 and throughout the year is to be focused and to have goals, not only for your professional, but also your personal and your health.
Mhm. And you're absolutely correct, because we experienced a lot during 2020. And coming into 2021, we absolutely recognize that we may have a lot of deficiencies when it came to our resources for mental health, not only awareness, but opportunities or spaces that we could have gone to get the help that we need, to find out what we can do, and to understand what's going on with us. And in our community with disabilities, and I want to add that that includes pregnant women, that includes persons with non-communicable diseases or comorbidities, heart disease, diabetes, lupus, sickle cell. We experienced so much more stress and anxiety. Just the fact that you have to go out for necessities or the needs that come out of the outside environment. And we can't forget our caretakers. We can't forget our support networks. And I'm talking about service providers like yourself and Dr. Kitiboni Adderley. We're talking about siblings, spouses, being in a domestic environment. We took on a lot during that time, and it impacted us because for 24/7, we were required to support, to protect, or even nurture our family members, or at times ourselves. And so, Dr. Kitty, let me tell you, you had a great talk about know your numbers during Tea Talks at Handling Your Health at Home, or Tea Talks Tuesday, Handling Your Health at Home, on 8 p.m. on Tuesdays, where you encouraged us to hydrate, rest, reduce stress, and breathing exercise to increase intentional actions. Now, I'm going to admit, all those things that you suggested, they free. Like we didn't have to go look for our coins for that. These were things that, once again, the importance was you and me, to take the intentional steps and the actions to increase that. But can you share what additional steps must be taken to keep our body's health aligned to support our mental health?
I think, well, two things that I focus on, because I'm also a health coach. So I use physical activity, of course, as a physical therapist, and food as fuel. And so the research is out there. The research definitely shows that you are what you eat. So if you want to make sure that you have good mental health, then you have to make sure you feed your body, your brain, what it needs. And we're talking about leafy green vegetables, right? Fruits and vegetables, real food, not processed, not packaged, real food, as real as you can get, as fresh off the tree, the vine, the ground as you can possibly get. The other thing that we want to emphasize, when we talk about omega-3, is like the healthy oils, salmon, meat, fish, nuts, right? Almonds and walnuts. People say that the walnut looks like a brain when you open it up and take it out of the shell. That's the kind of foods that you want to eat. Legumes, so your peas, your lentils, those are healthy foods that are going to fuel and give your brain food and the fuel that it needs to stay as healthy as possible. And as we talk about foods to add, I always want to talk about foods to avoid, and those would be the high sugar, the processed foods. I mentioned in the talk on Tuesday that they're now dubbing Alzheimer's diabetes type 3. And we know diabetes is the ability or the lack of the body's ability to control blood sugar levels, sugar in the blood. And so you have the sugar affecting the brain. And if your brain's not working properly, then definitely mental health is going to be impacted. And so on the other side, we talked about the fuel. Now let's talk about getting the body going, the engine going. We know that physical activity releases what we call the happy hormones, right? The endorphins. And research again has shown that physical activity gives you more energy. So if you're feeling lethargic and you're feeling fatigue, and these are sort of symptoms that come along with anxiety and depression, if you can exercise regularly, you can boost your energy levels. When you exercise, you burn it. You burn your calories, the body gets active. Of course, you need to rest. So if you're fighting insomnia, something else that can impact your mental health, you now want to rest a little bit more. So that's the other benefit of having the exercise. Outside of the fact that we know with depression and anxiety and ADHD, believe it or not, we think the kids are too active. We need to let them move and get all of that tension. And I say kids, because some of us adults have a touch of it as well, right?
Yeah.
I think I have a little bit. It relieves stress.
Mm-hmm.
And it improves your memory and it improves your mood. So the two things that I would add to the list is definitely your food is your fuel the brain. You want to make sure you give it the optimum quality fuel for it to run on. And of course, you have to keep that engine moving. You have to keep all your parts moving so that the blood gets to the brain functions better. You get your happy drugs, your happy hormones. And that's what I would add to the whole aspect of mental health and improving it.
Well, I can tell you one thing. The minute you said happy hormones and food, listen, that made my night, my day, my everything. Because it is two things that I love to do is be active and to eat. So thank you for that. That's my excuse, Dr. Kitty. All right. So if you're just joining us, you are here with Thriving Haven presents Thriving Thursdays. And we are talking about how's your vision. In the first half, we spoke about vision being what are your intentful plans for your future, for your mental health development, and to ensure that you have the best health this year. In this segment, we're now going to go into Glaucoma Awareness Month. And worldwide, January is recognized as Glaucoma Awareness Month. And glaucoma is one of the leading causes of vision loss and blindness. It's actually a group of diseases where pressure usually builds up and damages the optic nerve or the eye's optic nerve. We encourage you all to get regular exams, rest, and maintain a healthy diet to increase and also to increase support for those living with glaucoma. The most common type include the open angle glaucoma, which often has no symptoms other than your peripheral eyesight slowly diminishing. And when there's pressure on the iris, it interferes with the eye's fluid drainage system. And so low tension glaucoma occurs without elevation pressure to the eye. And angle closure glaucoma, although rare, may present as a medical emergency with symptoms of eye pain with nausea and sudden visual disturbance. There are currently no ways to restore your vision loss from glaucoma. So this is why it is important that we talk about prevention, early diagnosis or detection, and support. So, Jerome, now I want you to understand, you have one of the most important voice here. As they all can tell, it is 3 queens and a king to the whole kingdom. And so we love to hear what you have to say when we're speaking about our topics. And tonight, how's your vision also ties into the state of being able to see. Now, during Glaucoma Awareness Month, sight is one of the primary senses. You know, we have touch, we have taste, we have smell, we have hair, but sight is one of the primary senses that human beings use to receive visual stimulation. And that includes even watching commercials, audio-visual platforms, and such. As a sports and media specialist, I know you have probably witnessed this. So give us some insight on this. Athletes who still have to compete and show up, how do they adjust when they have eye injuries, or even Dr. Kitty could jump in on this, diminished vision, or, you know, we have a lot of persons who are taking the time to take the eye exams, or they're having symptoms, and now they've recognized that they are now living with glaucoma, or they have newly diagnosed. What are some of the support that we can give our family members living or with glaucoma, or our surrounding members?
All right. Well, good night again, folks. Again, thank you, you queens, for having me here. You know, as far from a sports perspective, just like you said, the eyesight provides one of the primary, I guess, sensory things for athletes, hand-eye coordination, and we can name any number of sports. Basketball, baseball, tennis, bowling. Like I said, any one of the sports, it's definitely one of the, I get the primary senses involved in, you know, being success. And just like you said, even and I wasn't even aware of it. Like you said, the peripheral vision. Again, with a lot of sports, football, basketball, you need to have that peripheral vision, you know, to kind of help you be aware, or like they say, court awareness, situational awareness as well. So it's definitely important. And you know, I've actually seen instances, you know, where as far as athletes are concerned, you know, they might be a little off. You know, their free throws might be off, their swinging might be off, and you're trying to figure out, well, hey, is it the timing or whatever? But when they go and get tested, which they should, you know, which again, some of the things that may be neglected, then you realize, well, hey, this might be the onset of something bigger. I find a lot of them might start wearing corrective glasses, and like you said, there is no repair from glaucoma. But again, we have to do things that, you know, to try to prevent or at least catch it early to see how we can at least cope with it. I know for a fact, even in my household, my dad suffers from glaucoma, and you know, just kind of some of the things that we have to do around the house to help out. You know, we have to leave on bright light. You know, try to make the areas as well lit as possible, and you know, just kind of guiding around the house, and just try to make things a little bit easier for him. And again, even with my aunt, again, they're a little bit up there in age, but again, regular testing is definitely needed. I can remember, you know, just talking to my aunt. I remember months, even years ago, she was like, "Hey, I don't like to drive at night. You know, my vision gets a little blurry at night." And you know, now going forward, you're like, "Hey, were these the early signs of maybe glaucoma? You know what I mean, or something else?" So again, these are some of the signs that we have to pay attention to.
Yes, and Jerome, thank you for that, because a lot of times we overlook all of these symptoms and these things because we're thinking about our stress levels. We're thinking about all of the anxiety that's happening during this time, all of the financial things, all of the things outside of us. So we do not check in with ourselves. And this is why Thriving Thursdays is so important, because this is the moment you get to check in on yourself, and you're not doing it alone. You have us with you to join and allow you to do that. So I want to give 5 glaucoma guidelines to remember. Now, more than over 3 million persons have glaucoma, and the numbers are rising. Glaucoma can affect people of all ages. Although generally associated with seniors, glaucoma can strike anyone since each person have their own level of eye pressure tolerance. So the demographics do play a role in glaucoma as the leading cause of blindness among African Americans. It is also highly prevalent in Hispanics over the age of 65. So the big question all of us always ask, is it hereditary? The risk of developing primary open angle glaucoma is up to 9 times more likely if your parents or your siblings have the disease. All right. And so there is hope. There is hope, even though there is no cure for it. You cannot restore your vision, yet with early diagnosis, treatment can help to slow the disease down. And so, how's your vision? Okay, this is another episode of Thriving Thursdays, and we cannot leave you without at least one takeaway from each of us, okay? So everyone, I want each of you to give one takeaway of what you said tonight about how's your vision. All right, Jerome, you go first.
All right, my takeaway is check out early, get regular testing. Don't ignore the signs.
Yes. Okay, and Dr. Tracey King.
So I will say the most important thing to really walk away when we talk about awareness is prevention. Whether it is talking about glaucoma or other physical ailments, but mental health is just as important to make sure that you check in with yourself. Make sure that you emotionally take a moment just to say, how am I doing? And if you find yourself struggling, then reach out to a mental health professional.
Yeah, and Dr. Kitiboni Rolle Adderley. That's a mouthful.
My takeaway is simply, let's just have a holistic approach to everything you do. If you do one thing right, everything will probably benefit from it. So I'll just re-emphasize, pay attention to what you put into your body. Your fuel is going to take care of you. So give your body the right fuel, as well as make sure you move. Your body needs physical activity. Every aspect of your body needs physical activity. And so you can't go wrong if you make better choices with the food that you put in and that you're committed to moving at least 30 minutes every day intentionally.
Yeah, and my takeaway would be reduce screen time. I mean, but not on Thriving Thursdays, but reduce screen time. And also understand that you are living with glaucoma. You are living with a disability. You are living with these things that are now a part of you. And you are going to continue to live once you focus on intentful involvement and action on your behalf. All right. So we're not getting down in 2021. We are facing and acknowledging and identifying what the issue is, and we are doing something about it. So we want to encourage you to join us outside of Thriving Thursday. And so one of the activities or events that are coming up, Dr. Tracey King and I will be a part of the University of the Bahamas Mental Health, Disability, and Law webinar. Now that's a mouthful. Mental Health, Disability, and Law webinar with the theme Challenges for Persons with Disabilities. That is January 21st. You don't want to miss that. You're going to register on the link. Go to Thriving Haven page. Go to University of the Bahamas page. Go to the Disability and Compliance Office page. Register. And it's from 10 a.m. to 12. So put it on your calendar. We also can't forget on Tuesdays, we have Tea Talk Tuesdays. And this is powered by the Spice Clinic and Pharmacy. This is 8 p.m. Eastern Time at Handling Your Health at Home, where Dr. Kitiboni, where she talks about wellness support. And her favorite tea talked organic herbal blends. Now listen, you think that you have had it all? You need to tune in on Tuesdays. And we can't forget our Jerome, where you can tune in to Sideline Sports Talk with Big L on the morning after show every weekday mornings on More 94 FM. And to close it off, you got me. And that's on Mondays at 8 p.m. Erin Brown Connects Disabled Lives Matter, where we present and we talk about all issues. Nothing is off limits. We're going to connect with all things disability, and that's on YouTube and Facebook Live. Well, I just want to say that we made it through another Thursday, Thriving Thursday. So don't forget to share, like, and comment in the link below. We want some of your tips for better health in 2021. So share it with us. How's your vision? You will receive below a link for a digital copy of Understanding and Living with Glaucoma for free. All you have to do is click on the link after this live, and you will have that access to you and your family that encourages prevention, early detection, and support while living with glaucoma. So I'm Erin Brown. That's Dr. Tracey King, Dr. Kitiboni, Rolle, Adderley, and there you go, Jerome, you can do it.
Yeah, and I'm Jerome, Rome.
And this is Thriving Haven Presents Thriving Thursdays. Thank you so much for joining us.
Everyone, take care until our next segment. Stay tuned. Anyone else have anything else to say before we sign off?
Be well.
Nope. All right. Bye, everyone.